Did you know that over 50 million adults in the U.S. suffer from arthritis? Yet many can't tell the difference between rheumatoid arthritis and osteoarthritis? In today's video, we'll be exploring the essential differences between rheumatoid arthritis and osteoarthritis, two common forms of arthritis that affect millions. Arthritis is an umbrella term used to describe inflammation of the joints. However, there are different kinds of arthritis, including rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is an autoimmune disease. It happens when your immune system doesn't work the way it should. When you're healthy, your immune system attacks invaders like bacteria and viruses. When you have rheumatoid arthritis, your immune system also sees your joints as enemies and launches an attack on them. The specific target of these attacks is the synovial membrane, a lining that lubricates and protects joints. Osteoarthritis isn't an autoimmune disease. You get it because the cartilage, spongy tissue between your joints breaks down, often due to daily wear and tear. As a result, the bones on either side of the cartilage start to change and ache. It's much more common than rheumatoid arthritis. Osteoarthritis happens because the cartilage in joints breaks down. Rheumatoid arthritis tends to cause morning stiffness that can last an hour or more. That's one of the things that sets it apart from osteoarthritis. Rheumatoid arthritis also can develop and progress quickly, and it tends to affect both sides of the body at once. It can develop at any age, though most often shows up in midlife. Other rheumatoid arthritis symptoms that set it apart from osteoarthritis include fatigue, low fevers, low appetite, joints that get forced into bent positions over time, lumps called rheumatoid nodules that grow under your skin. Osteoarthritis tends to develop slowly over many years and is most common in older adults. You might notice it in a single joint or on one side of your body. Your joints might swell, but not as much as with rheumatoid arthritis. With osteoarthritis, your main issues are pain, stiffness, with briefer morning symptoms than in rheumatoid arthritis, and stiffness that might come back after you're active, noises, cracking, grinding when you move the joints that don't feel as stable or strong as they once were. Both osteoarthritis and rheumatoid arthritis can cause hand symptoms, but are different. Rheumatoid arthritis in the hands is common, and it's usually in both hands. It most often affects the wrists and the knuckles. In rheumatoid arthritis, swollen joints might make your fingers look like sausages. Over time, the position of your fingers can change too. Rheumatoid arthritis can even damage and break the tendons that allow your fingers to bend and straighten. In some cases, you might develop numbness and tingling in your fingers. Osteoarthritis is more likely to affect a single hand at first, though it might affect both. That's because osteoarthritis attacks joints you use the most. Osteoarthritis in your hands is most likely to affect the base of your thumb or the finger joints closest to your fingernails. It can also affect the wrist. Osteoarthritis sometimes causes bony bumps over finger joints. Rheumatoid arthritis and osteoarthritis share at least a couple of risk factors. You may be more likely to get rheumatoid arthritis if you have a family member who has it. The same goes for osteoarthritis. Excess weight also seems to play a role in both diseases. Other things that raise your risk of osteoarthritis include older age, joint injury, overuse of a joint, deformed joints like knocked knees or legs of different lengths. The things that make rheumatoid arthritis more likely include being a woman, smoking, being around dangerous chemicals like asbestos or silica, having gum disease, possibly because the same bacteria might trigger joint and gum inflammation. Osteoarthritis can affect any joint, but it tends to happen in joints you've injured or use over and over. Think knees, hips, back, neck, thumbs, and big toes. Rheumatoid arthritis can also cause joint problems throughout your body. The disease is especially common in the small joints of your hands and feet. It also strikes shoulders, elbows, knees, and ankles. Unlike osteoarthritis, rheumatoid arthritis tends to leave your back alone. Can you have RA and OA at the same time? Yes, although it's relatively rare, it's possible to have both RA and OA concurrently. Each condition presents its unique set of symptoms and necessitates a distinct treatment plan to reduce joint pain. If you suspect you have both, consult your healthcare provider for an accurate diagnosis and tailored treatment strategy. Does osteoarthritis turn into rheumatoid arthritis? No, osteoarthritis and rheumatoid arthritis are two separate medical conditions, and one does not transform into the other. They have different underlying causes and treatment modalities. OA is more of a common form of arthritis related to wear and tear, while RA is an autoimmune condition. If you found this video helpful, please give it a thumbs up, share it with your friends, and don't forget to subscribe to our channel for more tips on living a healthy, active life. Thanks for watching, and until next time.